My name is Archie David. I'm an occupational therapist in the Philippines, and this is my story. One of the main reasons that really inspired me to study in Australia and apply for the Australia Awards was the knowledge that I knew instantly that taking the course would empower me to become a better occupational therapist, especially after seeing the curriculum of the University of Queensland will significantly help develop me professionally, and that would equip me with new perspectives and skills that would help uplift the profession here in the Philippines and ultimately help the persons with disabilities who we are sworn to actually serve. My master's in Australia underpinned the importance of what we call in occupational therapy an occupation or performance-based approach. So this veered away from the very traditional medical model wherein clients are practically seen as disorders or people with conditions or diseases. Here, we've learned to view persons with disabilities as individuals who had roles, who had cultures, who had specific interests and values, and we had to design programs that were meaningful to them, that they saw were important, and not just impose interventions and treatment plans that we feel are going to be suitable for them. This exposure enabled me to set up the Independent Living Learning Center, or ILLC, which aims to help individuals with developmental conditions attain their optimum level of independence to become happy and productive members of society. Every day, you see children getting better, seeing them walk their first step, seeing your kids speak their first word, seeing them go to church with their family for the first time without creating commotion, gives us so much fulfillment. We, of course, have students who have progressed tremendously to the point that they are now included in the mainstream society. The ILLC offers programs to help our students become independent in self-help, in home management, leisure, socialization, and work. From my master's in Australia, I was able to gain very rich perspectives and skills on how to facilitate work rehabilitation. I knew that there was a need for a program for adolescents and young adults, and these are transition and work training programs. These programs were designed specifically to help individuals with developmental conditions develop work skills that are important for eventual employment. We have produced food checkers, bartenders, clerks, assistant librarians, encoders, all doing their parents proud.
Oh, it's great to have employees from Independent Living Learning Center because they inspire our people, our employees, and it's one of our company's advocacy to help these people with special needs.
As an occupational therapist, I actually felt that there was a dire need for therapy services for children who come from very poor families. These are families who live in slum areas as informal settlers. Families who wouldn't even have the means to pay for a tricycle or a jeepney ride to the center. And the solution to that, I felt, was setting up community-based rehabilitation programs in various local governments, including Mandaluyong City. In the CBR approach, we train not just family members, but also community helpers such as village health workers, public school teachers, social workers, to help identify who among the kids in the city are at risk of having developmental conditions. In this approach, the families are taught important skills and knowledge to help themselves in rearing and caring for their children more properly. Without the Australia Awards, I feel that I wouldn't have been able to accomplish all of these in the field of CBR. Through the Australia Awards, I was able to gain important skills and perspectives that helped me instigate change in social transformation in the country. In 10 years, I see the educational system becoming more inclusive. I would want students with developmental conditions mainstreamed in regular classrooms. I also dream of having CBR replicated nationwide, and I aspire to help the Philippines graduate from being a recipient of knowledge to that of being an innovator and contributing new bodies of knowledge that would help the global advocacy for a more barrier-free world for people with disabilities.